Welcome to the Saatchi Wellness Center and to Healthy Spaces. I'm Diane Bays. Some of you I'm meeting for the first time, and we've emailed and corresponded about your system, but I'm the owner of Healthy Spaces, my husband Mike and I, and we've had Healthy Spaces for 10 years, and just 13 months ago introduced the magnetic resonance stimulation system. And so this is all a relatively new concept to us, very new to all of you, and I just want to commend you for being willing to take that leap of faith on a technology that is really still very new in the United States. Dr. Elliot is a naturopathic physician in Portland. His career began as a high school science teacher in San Jose, so he's a great person to have up front teaching us. He came to Portland to attend the National College of Naturopathic Medicine and earn his naturopathic doctorate degree. While at NCNM, Dr. Elliot was selected for the prestigious Family Medicine Residency Program and received the Making a Difference Inspirational Award from his peers. It was during this residency that he gained hundreds of extra clinical hours and completed advanced studies in endocrinology and thyroid disease. So several months ago, Dr. Elliot integrated the use of PEMFs into his practice, and he's kind of leading the way in the Portland area for wider use of this technology in the naturopathic community. So help me welcome Dr. Travis Elliot.
Thank you, Diane, and thanks all of you for being here. And again, I want to reiterate the fact that I'm not an expert in PEMF technology. I'm not an expert with the MRS. I started using PEMF technology in my clinic just about a year ago, and then a little bit after that was introduced to the MRS system. And so I'm still, reading the same books you all are reading, and maybe I have more wider experience, each day with different patients. And the other naturopath in my office, Dr. Igor Schwartzman, uses the MRS on his patients. But I'm still here learning along with all of you. And so thanks for teaching me. And what I wanted to teach you all a little bit about today, Diane and I thought it might be useful to focus, the few minutes that I have on sleep, because it's a common benefit with the MRS. And just want to start with a little brief thumbnail of a case study. A 62-year-old woman, we'll call her Mary, who had a 29-year history of insomnia ever since her first son was born. And her particular insomnia was not being able to go to sleep for at least an hour every night, would wake up quite often during the night and have trouble going back to sleep. And she was introduced to the MRS system and decided to use it because of osteoporosis. Had heard that and read that it could be beneficial for increasing bone growth. So she got the system and started using it, and very quickly noticed huge changes in her sleep. It's such a simple thing to say, huge changes in your sleep, but for those of you who may have struggled with insomnia, it's such a life-changing, positive benefit to all of a sudden not have to struggle to fall asleep, not have to struggle to fall back asleep in the middle of the night. Have wide-ranging health implications. So in my office, Dr. Schwartzman and I were talking about how when people get on the MRS machine, almost everybody notices a significant drop in blood pressure and a drop in heart rate after 24 minutes, 8 minutes, 16 minutes, whatever it is. So I want to ask you, what's the connection there between the drop in blood pressure, the drop in pulse rate, and Mary, the improvement in being able to go back to sleep? Can anybody think of some physiologic connection that might bring those two together? Yeah.
Well, when you're kind of agitated, it's a little hard to get to sleep.
If you're agitated, it's hard to get to sleep, right? And so what does the MRS machine do then?
Relaxation.
Somebody said it back there. It relaxes you. Okay. Anybody know what part of the body is affected in that relaxation?
Adrenals. Nervous system.
Adrenals, part of it. Well, what I really want to focus on tonight, which I think has a really profound effect, and research has shown there's a really profound effect with the PEMF technology, is the nervous system, right? Anybody know what particular part of the nervous system? The autonomic nervous system, exactly. So back to Mary, she when I asked her, what was it like when you couldn't fall asleep? What was the experience of not being able to fall asleep? Her particular experience was that she couldn't stop worrying. She was stewing over things, going over things in her mind over and over again, whether it was when she tried to lie down and go to sleep or wake up in the middle of the night, stressed, worry, 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 worry. Okay? So for her, what got calmed down was that worry. Okay? And the major part of our autonomic nervous system that creates worry is what? Does anybody know?
Sympathetic nervous system.
The sympathetic nervous system. Raise your hand if you've heard of the sympathetic nervous system. Okay, good, most of you in here. Raise your hand if you've heard of the parasympathetic nervous system. Okay, good job. Raise your hand if you know those are two opposites. Okay, good. So the parasympathetic and sympathetic nervous system are the opposite ends of the autonomic nervous system. And we experience those, and they have a huge impact on our lives every second, every minute. Okay, can anybody tell me more about the sympathetic nervous system? What is like 3 or 4 words that could describe that?
Your fight or flight.
All right, the fight or flight. So the sympathetic nervous system, we'll abbreviate it as, Mike, I hope this doesn't, is the fight or flight. Okay, and then what was the other one? Parasympathetic nervous system, yep. Couple words for parasympathetic nervous system.
Relaxation.
Rest and digest.
Rest and digest, relax and repair, yep. SLUD, I think that was the medical school acronym. Salivate, lacrimate, urinate, and defecate. SLUD. SLUD. Salivate, lacrimate, urinate, and defecate. I like rest and digest. It's probably more appropriate. Okay, so the the picture that usually gets painted for the sympathetic nervous system is the being chased by a bear, or you could describe it as hunting, where you're focused on accomplishing a goal. There's a stress involved, and physiologically you have your blood shunted away from your digestion. Okay, it goes to your muscles. Your eyes change so that you can see far distances and be aware of danger, be able to pick out whatever you're hunting for. So your digestion kind of shuts down, and you're very focused, and that can be very valuable. Can anybody think of a common habit that does that same thing? Especially in Portland.
Coffee.
Coffee, right. So coffee really stimulates that sympathetic nervous system. Coffee, I like to describe to my patients, is a cup of fear. You drink it, and it gives you that same physiologic experience of fear, and it activates your sympathetic nervous system. And research shows that if you have a specific, especially rote task that needs to be done, caffeine, that kind of awake stress mode is really helpful. Okay. And then the parasympathetic nervous system, physiologically, it comes from the top of your spine and the bottom of your spine. All the nerves branch out, and every organ of your body is wired with both of these. So it's like you can turn on a balance, sympathetic, parasympathetic. Okay, and when you have the parasympathetic system turned on, you have better digestion, you're more relaxed, better kind of creative thought. Okay, just a couple simplified images for that. Just to wrap up this whole topic of sleep, is that it's not all about the autonomic nervous system, and it's not all about, because there are some people who get help who have trouble sleeping, but it's not about worry, like Mary. And I just wanted to share one other case, a woman named Debbie, who's 61 when she first got the machine, and she'd had insomnia literally her whole life. And it wasn't around worry and stress. I mean, she had insomnia when she was a kid. And she was so sleep deprived by the time she was 60 and through college and everything, that she would sometimes only get 3-4 hours of sleep a night, and that would accumulate until finally she would be able to crash, but she'd only sleep for 4 hours and then be wide awake again. And it brought a lot of stress. She would get angry in the middle of the night. She's tried everything. She tried all these kind of relaxation techniques before going to bed. She could be totally calm, Epsom salt bathed out, yoga, everything, and nothing would happen. And she tried the IMRS 3 times a week. She's driving down here to Healthy Spaces for pain, and it did help her back pain. But then she started to realize, oh, wait a minute, on the nights that I come down and do the MRS, I sleep. And she'd kind of given up on the whole sleep thing, so it took her a while to actually realize, wait a minute, I was having these nights of sleep, and she went back and looked in her journal, and oh yeah, it was corresponding to when she got the PEMF treatment. So she got a machine, took it home, and consistently every night now she can fall asleep and sleep through the night as long as she's on the mat before she goes to bed. And I think she does it twice a day. And if she misses a day, then she goes back to not sleeping. So it's not necessarily curing her problem, but she doesn't care at this point, right? She's for the first time sleeping.
This is the only book of its kind in the United States by Dr. Joel Carmichael. And it's not an easy book to find. It's not on Amazon. It's only available through Dr. Carmichael, who self-publishes. On November 3rd, when many of you came and we introduced this to you, we had a gentleman who joined us pretty much because his daughter-in-law dragged him here. And in our second workshop, it was focused on healthcare practitioners, so they had a little background already in what pulse magnetic fields were about. That was the only workshop Fred could get to, and here he was. He really didn't even know what we were talking about, and raised his hand and asked the speaker, Hermina, what was going on here in this room. And she could tell some challenges that Fred was having. She laid him right on the mat, and I won't steal his thunder. He can talk about what happened that day and what's happened since. But Fred and Sally, where's Sally, his wife, came up here from the Bay Area. We actually scheduled this around their being able to be in town. Fred is former president of the Oakland, California YMCA and president of the San Francisco YMCA. Currently, he's president of a fundraising firm and top court a volleyball program with 24-hour fitness. And he and his wife Sally have 3 children and 5 grandchildren. And Fred's going to take a few minutes and share with you what his experience has been. Fred,
Okay.
Thanks for being here.
Thank you. Good presentation. Some of you I met November 3rd, and I'm glad to be back. It was most interesting because I came here with my daughter-in-law. I had started with Diane 3 years ago with the Athena water machine, the alkaline water. A lot of you have been using that. We bought a machine, and I had tremendous arthritis on my thumbs and hands, and started drinking the alkaline water, and all the pain went away. And I said, this Diane is a miracle person. So every time I can come here, I come here to revisit. And we did buy infrared pad, and that's worked for my wife. And so when Christy brought me here, and we looked at the pad, and then Hermina saw I was doubting that this stuff really worked, because there were a lot of you here and a lot of chiropractors who had been using this and had some testimonials. Fortunately, Hermina is very smart. She said, get on there. And she put me on there for 14 minutes at 25 intensity. Now, I've started with Parkinson's last June. I found out I had beginning of Parkinson's disease. What happens was I had an essential tremor in my right hand. And I used to get this whenever I was nervous or when I was stressed. My hand would tremble very much. And now today it's trembling some because I'm a little stressed being here doing this. But I then adjusted and started drinking my coffee and my wine with my left hand. And I found that I could really beat this, whatever this tremor was, not knowing it was Parkinson's, by adjusting my behavior in everyday life. The thing that really troubled me was the mouse on the computer. I kept screwing up. And I realized it got worse. I was screwing up with the mouse, and I thought this. So I went last June I am a member of Kaiser Permanente, went to Kaiser to a neurologist. She gave me an hour of test and said I had the beginnings of Parkinson's. I went last Tuesday for my next visit, which was preparing for this week, but I really didn't know. She had given me all these tests. The lip tremor went away. The leg tremor that she found went away. I don't have that anymore. And the right arm tremor is still there, but not as much. Now, after talking to Hermina here, I bought one of these machines, took it. It was sent from Florida, started it, and have never been off it since November 10th. And what I find, and I saw Beth the other day, and I said, Beth, be disciplined. If you're going to do this, discipline yourself to do it. Because I've been emailing from certain people that Diane has said that are doubters or it didn't work or whatever. And it's because people hit and miss on the machine. Every morning I get up and I go and I lay on the mat for 8 minutes at 100 intensity. And I'm really jazzed in the morning because it creates energy and I feel much better. I used to, and I work from my home, take a nap every day. I don't take a nap at all now. And I find that's really interesting because it's not that I said to myself, you don't, because I always call it a power nap. It's a power nap, see. But I don't do that anymore. I don't need to. I find it's quite interesting. So after lunch, I'm on it for 16 minutes at 50. Then I use the pillow anytime during the day at 8 minutes at my neck. Usually it's right in the back of the neck at 50. And then when I go, just before I go to the bed, I do it 16 at 10 intensity. I'm very proactive in my life, and I'm trying to defeat Parkinson's any way I can do that. And I'm finding with this system, it's really working. And the doctor, and this is a Kaiser doctor, which they're very proactive, but she's very doubtful. And she said, what is this system? So I shared with her. Half the visit this time was talking about the system. So she finally said, give me the email and the website. I want to find out about this. So maybe in your field, doctors need to be convinced, especially the old traditional doctors, about how this really works. So what I wanted to do, and I have a great relationship with Diane and Mike, is to be able to share with you how I have become disciplined at this to beat Parkinson's. In my brain, which is suffering from Parkinson's, I'm trying to learn as much as I could to do that. Now, Hermina has been great for me because she emails me every Wednesday. She's my mentor in this. And she had an experiment and asked me to do the experiment, was to lower the intensities to 10. And I felt nothing. And I said, 3 days into this, I emailed back, said, this is not working. I've lost some energy. I've lost some of the capacity for what's happening in my body. So she then gave me the system that I'm on now with the intensities. And it's really working for me. It's comfortably. So I have a friend who's a great carver, and sisters came and visited me last month, and he had just began stem cell therapy for a knee that has cartilage on bone. So he has just horrible pain, could hardly walk. So I take the probe, put it at 400 for 16, 3 sessions in about 16 hours, and all the pain went away. And he says, this is a miracle. Well, you people that use them for pain know that it is a kind of a miracle. Now, I don't understand how it works. I've been trying to read Carmichael's book. Now, Carmichael's book is great because it focuses in and gives you an intensity to use. But the manual is good, too, because it takes Parkinson's and breaks it down from full Parkinson's, like we were sharing, a person that Mike was sharing today, a person that can't talk and can hardly move and has been in hospice for a year of Parkinson. I thought, geez, I don't want to do that. I don't want to be a part of that. So Mike, it gave me a more incentive today because I'm saying, wow, this is really a serious deal here. So I'm learning about Parkinson's. And when you have a disease, like when I never had Parkinson, I knew nothing about it. And I really, it didn't interest me at all. Now that I have it, it really interests me. So I think that's kind of a natural situation. I can tell you how I'm sleeping better, I have more energy, I'm more intelligent. I feel my brain is more intelligent. Now, prove it on any kind of test, I can't do that. But I do know, I do volleyball every Saturday and Sunday to teenage girls. And last Sunday, my lesson, I took my right arm, which has the tremor, and I hit 300 balls like this and had no tremor for 24 hours. Amazing. And before I was just, like this. And the kids that I have are they'd say, Fred, your arm's shaking. Oh, then, and I can't hit the ball with my left hand because I'm right-handed. So I'm constantly was adjusting my body to overcome the Parkinson's. Now I'm realizing with this, I can overcome it in a different way.
I've had a traumatic brain injury since I was 2.5 years old. And I was depressed all the time from that. I had difficulty smiling. I had difficulty interacting with people. I had a whole lot of other issues that have nothing to do with the IMRS machine, and I have dealt with them in my own type of healing. But the IMRS machine, we put the carotid artery 4 minutes on this side, 4 minutes on this side. Okay, the depression left forever, like gone completely.
My name is Dolores Majori. I'm a licensed clinical social worker, so most of what I'm talking about is mental health in my clients and in myself and my family. Diane said prepare a statement. So as far as my personal use or my family's use, in general, we've noticed improved sleep patterns, less irritability, greater vitality, and for me, rapid relief of back and sciatica pain. Concerning my psychotherapy clients, one client who is very anxious, obsessive compulsive, basically says, I'm so relaxed and I can focus on one thought at a time and shut it off if I want at will. And that's really important for her. Again, she said in another session, I was so tired, but I'm really relaxed now, and I'll probably be real focused and motivated and productive when I get home, like the last time I used it. Another client who also is extremely anxious, suffers from PTSD, says, what has helped me and my partner come to a greater level of tenderness, more patience and comfort and relief in one another. My alarm system, my reactivity, completely shuts off because of the balancing of the autonomic nervous system.
I've been involved with and practicing alternative medicine for probably close to 40 years now. I met Diane, 5 or 6 years ago when she was just up the street here. And she's quite an innovator. She's dynamic, she's intelligent, she's creative, she's really driven by her passion to make a difference. So I tend to listen a bit more to her than I might to somebody I was not as experienced with. And she told me about the IMRS, increased sleep, as you mentioned, more stamina, less fogginess in my thinking. It's reduced a minor neuropathy in both my hands and my feet, but quite noticeably. I've introduced it to 6 other people. They've all had very amazing results with it. I'm very interested in seeing what the longer term effects are. As Dr. Oz says, they're the new form of medical science. That's where we will more and more go to. And I'm very encouraged with the friends who've been able to reduce, and in consultation with their medical doctor, have been able to reduce medications, where the old amount that they had to take every day is gradually they've had to reduce it because they began to get effects from the medication that weren't there before. You have to use it. It's really important. If you're going to use it, if you're going to make a piece of equipment, if you're going to give it a fair trial, you have to use it and use it every day. I find a difference whenever I use it once as opposed to twice. I find it marginally different if I use it 3 times. I find it different if I use the mat at least once a day. And I find that I use the pillow for specifics. If I've got a knee that has been bothering me for 10 years, and if I use it on the knee, It doesn't bother me. I put the probe behind my knee. I can read, I can write, I can do a lot of other activities, and it's handled. I hear the thing go off and I put it away. So it's extraordinarily easy to use, and I believe, again, extremely effective. That's been my experience.
My name's Claire Meldy. I'm a body worker. And so first I had a fall just to test it out, make sure how it worked. And it was just amazing. And so I was sharing with people about it. So then I did another one just to make sure. So I can tell you that for acute injuries, it was fantastic. I do deep tissue body work, and so I started on experimenting first on my sister, and her leg was so tight and a big tight muscle, and used the pillow on it for 5 to 8 minutes. Totally went away. I mean, like no pain, no tightness. We both kind of go, oh, wow. Anyway, and it stayed gone. And so I've been using it in my practice on different people, and some people go, oh, do it here, oh, there. And then I use the probe like on the really sore muscles underneath the arm, so I just stick that on while I'm working on another part of the body and such. So I could go on and on and on and on.
I was having a lot of muscle cramps every night. Sometimes I'd wake up 2 or 3 times a night with muscles cramping. And the first night after I got on the machine, that was the end of all the cramps. And when I went out of town, I didn't take my pillow with me, and I got cramps that night. And so from then on, the pillow goes wherever I go. So it completely eliminates muscle cramps. And I recently had another one where I did an extensive workout, and I stretched my muscle in my chest. And I did that in the early morning, but I didn't feel any pain until about 4 o'clock. And it started getting worse and worse. About 8 o'clock, I couldn't breathe. It was like had a rib broken. I couldn't even breathe without extreme pain. And so I was about ready to go to immediate care when I thought about the probe. And so I got the probe out and I put it over that area, and within seconds, the pain started going down. And then within 5 minutes, it was 90% gone. And next morning, I had zero pain, all gone. And I must have really torn a muscle severely, and yet it was gone with just 5 minutes. So that really convinced me that what this does is it helps your body recreate cells. And when you recreate cells, then you can heal anywhere.
When Dr. Oz did his show, I was like, oh my gosh, I want to get one. I was so excited. And I tried to Google and figure out how to get it. And it was really hard at first to figure out where to get them. And I finally found Diane. And I called her up and I was like, oh my gosh, I'm so excited. And I told her everything that I knew and I'd heard and I'd read. And I started sharing stories with her. And we went in to see it, to try it for my husband. But he has a spot in his back that always hurt. So when we went in to try it with Diane, my husband tried it, and when he got up, that spot in his back was gone. And he was like, wow, it's gone. And that's never normally gone except for with the manipulation of this one osteopath. And a week later, for the whole week, it stayed gone. So for an entire week, and it ended up coming back. We ended up having to make this a regular, thing for him. But for an entire week, the spot that even some of the best osteopaths and chiropractors couldn't get rid of was finally gone.
One of the first analogies I heard was with this chronic pain thing. It's like taking a hairdryer to a big block of ice. And if you keep going and keep going, I believe from everything that we've seen that you can melt this problem. Maybe not away, but you can get a much smaller block of ice that makes your pain more manageable.